Hi, I'm Dr. Jay Heintz with Houston Injury Solutions Network, and today I'm with Dr. TJ Jones of the Spine Institute of Southeast Texas. And Dr. Jones is an orthopedic spine surgeon. Dr. Jones, one of the things that our patients are constantly needing education on is, what is a disc herniation? And is it different from a bulge to a protrusion to all those terms? Are they all the same, and what does that mean?
Sure, that's a great question. Oftentimes when patients get their MRIs, they're going to look at these reports, and these reports are pretty bulky. They have a lot of different things in them, and the radiologist is going to mention every single thing because they don't want to miss anything because it exposes them to medical legal issues. And so when you see a disc bulge, it doesn't necessarily mean that you have a problem. A disc bulge, the best way I can describe it and how I tell my patients is that if you imagine you have an Oreo cookie, and you take that Oreo cookie and you just kind of smash it just a little bit, and then the white cream kind of comes just to the periphery and just bulges out a little bit, that's a disc bulge. It's not necessarily a herniation. Now, if I press that Oreo cookie and then that cream shot out, that's a disc herniation. And so disc herniations become really important when they start to hit the nerves, because that causes displacement, which causes pain, and no one likes pain. And so there are definitely different types of disc herniations. There are protrusions, there are extruded discs, where you may have a fragment that sticks out really large, a long way rather. You may have a sequestrated disc where the disc itself kind of shot out and then it broke away from its base. And so there are different kinds of disc herniations, but a disc bulge is not necessarily a pathologic finding.
Okay, so if we get the bigger herniations or the extrusions, one of the other questions that patients ask me is they say, well, is there a certain size in the neck or a certain size in the low back that definitely has to go to surgery, no questions asked?
Sure. Interestingly enough, I've been around a lot of different patients, and even my former, or I guess my mentors at the Texas Back Institute. I recall specifically, one day I was with Dr. Rick Geyer up at the Texas Back Institute, and we had a patient, and we were actually looking at their images of their low back prior to walking into the room. It was a massive herniation, massive herniation. We walked in the room, and the patient looks normal, looks just perfectly fine. And so, I try not to use a number to treat patients. I more so try to treat the patient and how they feel. So if I walk into a room and the patient looks perfectly fine, then there's nothing wrong with trying some conservative care. If, however, we walk in the room and the patient is in thriving pain, or if they've had any kind of issues with their bowel or the bladder, then we have to get more aggressive, and that's irregardless of what size it is. And so there's not like a one-stop shop for all. I think it's more so a matter of how the symptoms are affecting the patient.
So what I'm hearing is that it's not so much size or which way it goes, but more how it affects the patient's physical being.
Exactly. And the reason why is because God made us all differently. Some people have a large space for their spinal column and for their spinal cord and their nerves, and some people have a very shallow space. And so if someone has a really large space, a 7mm herniation may not be that big of a deal for them. But if they have a really small narrow canal, a 3mm herniation may be a really significant problem for that patient. And so it's really important that we treat each patient individually and try to tailor treatment for them.
Thank you, Dr. Jones.
My pleasure.